Welcome to the Obesity Matters Wellness Workshop, where we embark on an incredible journey together towards better health and wellness. Whether this is your first time or you have been with us since we started this program, we are so grateful you are here. My name is Rachel. I'm the Vice Chair of Obesity Matters, and I am your host for this year-long program. Today's topic, from stigma to support, a new approach to obesity treatment. Today, we are joined by a very special guest, Dr. Michael Crotty. Mick, please tell us a little bit about yourself before we dive in today.
Absolutely. Thanks very much, Rachel. Mick Crotty is my name. I'm a GP or family medicine doctor, depending on what part of the world you're in. I specialize my practice in obesity medicine. More importantly, I'm a diehard Oilers fan. Lived for 5 years just outside Edmonton, developed an addiction to coffee and hockey. As an Irishman, I never heard or saw ice hockey ice hockey as we call it here, before I moved to Canada. And now I'm getting up at 1 and 3 a.m. in the morning to watch the Stanley Cup final. So in Ireland here, I run a medical weight management clinic. I'm the lead for obesity with the Irish College of General Practitioners. So I have a relatively important role in educating doctors around obesity, weight stigma, bias, and evidence-based treatment. And similar to in other parts of the world, we have a lot of challenges in treating obesity and the understanding of obesity.
I feel like the best place to start is actually, if you could share with us very simply, how do we define stigma and bias, and is there a difference? And maybe a short example just to help us really understand what that means, because we're going to use those two words a lot today.
So I suppose my understanding of stigma is, negative thoughts and assumptions about somebody based on their body size, their shape, assumptions perhaps about their lifestyle, about their nutrition, about their health, assumptions about their intelligence, about their motivation, based on body size or shape. Unfortunately, it is ubiquitous in society. We see it in the media, we see it in society in general, we see it in healthcare hugely, where people are denied treatment. You go into your doctor and unfortunately any and every health issue and symptom you have is blamed on weight, and if you just lose weight that will get better. Whereas actually, and again that's because of the lack of understanding of obesity as a complex, progressive, chronic disease. This idea that it is lifestyle, lack of motivation and willpower, none of us had the understanding that this is genetics, it is biology, it's environment, it's much more complicated. We see lots of kind of stigma, blame and shame about obesity. I suppose it has a huge impact on accessing treatment and a huge impact on people being treated for this medical condition.
There's stigma or bias. How does that affect our health? And are there long-term effects on things like our mental well-being and our physical well-being?
I suppose one, on an individual basis, if somebody is exposed to stigma and bias, weight-based stigma and bias, it has a significant impact on people's psychological health and well-being. We know my risk of depression, anxiety, psychological stress and well-being is significantly affected. It can lead to social isolation, it can lead to stress and the impact that has on our physical health, whether it be blood pressure, whether it be heart disease, long term. Some people, in response to bias and stigma, they may run into maladaptive responses. So if I'm blamed and shamed for my weight, I will turn to disordered eating, dieting, restriction to try and lose weight, and probably in a very unhealthy way. When somebody is exposed to stigma and bias, they're less likely to engage in physical activity. They're more likely to turn towards lower quality foods. In a healthcare setting, having any and every medical issue blamed on weight leads to people not going to seek medical treatment. They don't trust their practitioner. They don't get as much time with the doctor or healthcare practitioner. They often feel dismissed. They may be not referred because the healthcare practitioner may not feel that they're motivated to manage their obesity. People end up postponing or cancelling appointments, changing doctors frequently. Things like screening. So whether it is pap smears or mammograms, people are less likely to go for screening to seek out healthcare when they are exposed to bias and stigma. So it has a significant impact on health, well-being, delays in diagnosis for different medical issues, and I suppose delay or not receiving treatment for obesity is probably kind of, one of the biggest issues that, and again, even in your poll there at the start about people feeling that excess weight or obesity is their own fault because that's what they're being told. Just eat less and move more. That's the answer. And again, like many other people, telling somebody who's living with obesity to eat less and move more is a bit like telling somebody with asthma to take a deep breath and stop coughing, or telling somebody with depression to just cheer up. It's a lovely idea, but it's a gross oversimplification, and it doesn't show the understanding of how complicated obesity is.
I wonder if you have any concrete strategies that you typically share with your patients to ensure that they do feel comfortable talking about what's going on, make sure that they feel seen and respected, maybe even just recognizing when you're not, no matter what their body size.
Yeah, I suppose from my perspective, again, I'm probably privileged in that I work in and I run kind of a dedicated weight management clinic. So people come to me to talk about excess weight and obesity to seek treatment for it, but I will still ask their permission to talk about weight. Because it is such a sensitive topic, because it is very stigmatized, we talk about patient-centered care. So I ask their permission, do you mind if we talk about your weight? Because it is a very sensitive topic. When I work in general practice, it's not always appropriate to bring up weight or obesity. So by asking permission, you're putting the person at the center. And it just is showing recognition that this is a sensitive topic that people may have had negative experiences with in the past. So by asking permission, I find that a good way of approaching the topic.
What if you're on the other side and you're that person that's, not fortunate enough to be meeting with someone like you that has that better understanding and ability to look more holistically about what might be going on? So as a patient, what are some of the things that you can do when you're faced with the opposite of your approach?
And not always possible to seek out a new doctor or find somebody who's kind of understanding of it. But really for me, if somebody wants to have the conversation with their healthcare practitioner, this is not a simple door handle issue that you mentioned on the way out the door. This is conversation. So booking a specific visit to talk about it, I think is helpful, rather than getting my prescription refilled and I'm talking about my, a few other things. And then this is not an add-on. This is something that deserves time and attention.
I just wanted to talk a little bit about maladaptive responses. I was really interested as I'd never heard that term before. So I was part of the medical bariatric program here in Ottawa, and I participated, and the kinesiologist who came on, he was excellent, very positive. He was really promoting physical activity because that's what he was there to do. And I asked him, and I said, why don't I want to exercise? Why do I have such a negative inclination towards exercise and not very positive things to say about people who I do see exercising? What is wrong with me? And he just couldn't answer it. And he said, well, you just have to try. You just have to do a little bit at a time. And I have been successful and I have started to exercise, but it was really hard. And when you talk about maladaptive responses, how do you explain that to a healthcare professional? Because it was such a roadblock.
There's a lot of interesting things in what you said there, as in kind of, you're saying like, what's wrong with me that I don't want to move? I suppose I come at it from the point of view of like, good health behaviors are important for health. But like, if I'm a caveman, I'm not supposed to be moving very much. I'm supposed to be conserving energy. We're not evolved to move and exercise and go jogging. Like that's a totally modern phenomenon. We're evolved to, live for today, don't worry about tomorrow, to get the most calorie dense, tasty food possible, because that's what's going to keep me alive in a world where food is scarce. So from an evolutionary point of view, you could argue that all these kind of health behaviors are not actually what we're evolved for. My biology is an issue when it is, in the current environment, but in a previous environment of food scarcity, I'd be a great survivor. There's nothing wrong with us. That's what we're supposed to do. But again, on social media, online, from the point of view of, I suppose, maladaptive responses, we know if we blame and shame people, if we back them into a corner, it makes it more challenging to make good health decisions. So blaming and shaming people doesn't work. It actually causes the opposite of what we want. And again, if we think about, like, I don't like the word exercise, it's movement. It's about movement because, sometimes like I said, it's so overwhelming with all the things I think I need to do. Where do I start? So it's a case of, okay, let's pick something small. And people are into goals. A lot of people talk about SMART goals. It's achievable. That's a good one. That's the A, yeah. So it's kind of, what could I do? Let me pick something that I'm, 60% sure that I can knock out of the park, and let me do that. And then let me move on to something else. So it's kind of meeting somebody where they are and building on things, but doing things, there's no point me trying to focus on a movement that I think is miserable, because it's not going to work. I'm not going to keep doing it. So what do I enjoy doing? What could I do consistently over the next kind of week or two? Maybe it's walking the dog. Maybe it is going for a swim. Maybe it is, like I said, parking a little bit further from the exit. But it's also about identifying, what are my barriers? So maybe I've got knee pain. It's kind of starting slow, going gradually, working with people, but also it might be good for my health, but it doesn't necessarily mean it's enjoyable. But is medication really a solution? There's no solution. There are treatments. There are many reasons why weight can change. Figuring out why my weight is here is a bit like eating a can of beans and then wondering which bean made me fart. There's lots of beans in the can, and it's not one of them. It's the combination. The challenge is, whatever has caused my weight to get here, my body is now defending this weight. It does not want me to lose weight. This idea, the set point, the thermostat in my brain. So even if I move to a country and because of the food environment I've gained weight, well, now I'm here and it's affecting my health. That's why I need treatment for it, because my body is going to keep me here. So treatment is not a solution. It is to try and bring it down and keep it down longer term.
Thank you so much for those additional insights. Thank you for joining us today. Remember that our journey towards better health is not a solitary one. We are all here to uplift and support one another. Thank you.